Okay. Welcome to DM Orthotics. Today we are going to be looking at fit and growth of our DM orthotic products. You will hopefully have looked at our videos which will show you how to put on and take off your DM orthotic product. As you can see today, we are looking at the suit, but checking the fit will be the same for any of the other products that we make. So what you want to do when you've got the suit on the child, this may be done in lying or sitting or standing. And for the purposes of the video, we're going to do this in standing today. So we want to check that the fit of the suit is good. This will be done initially by the clinician fitting the suit for you, but maybe as a parent or as the patient yourself, you will want to keep an eye on this as you're wearing it on a daily basis. So let's start with the initial fit. So the suit has been put on. Now we just want to check that it's not too tight. It needs to be a snug tight, but not an uncomfortable tightness. This is difficult to explain in some cases, but the way to feel the difference is to look at the suit to see that it is a good fit, to ensure that your side seams are actually at the side of the person's body. And then we're going to check all the openings, all the edges of the orthosis. So if you can get your finger underneath the leg and run your finger easily around the edge of the leg. Yeah. If it's too hard to get your finger into there, then it's likely it's going to be a little bit too tight. If it's very easy to get your finger into there and it's very, very loose, then again, perhaps it needs altering to be a better fit. But this is looking a good fit. Okay, and we're going to do the same with the arms. Run the finger around the edge of the arm seam on both sides and then check the neck. So we want to make sure that we can get the finger in around the front and around the top of the shoulder easily. And just check the same on the back, making sure that you have the overlap protecting the zip. Okay? So I'm happy with the fit of that suit. So once you're given your suit or product from DM Orthotics, it's always very useful every time you take it off to just check that fit. Now, when you take the suit off or any other product that you've got, you will have marks. If you wear socks and you pull the top of the socks away, now these may be slightly different, but you will see a mark at the pattern of the sock. The socks aren't tight, but you will get an imprint. You will get the same with a DM orthotic product. You will get that imprint probably around the areas of the edges and on the zip. But this should only last 25 to 30 minutes maximum. If it's lasting longer, that might be telling us that some areas are a little bit tight. So, on a daily basis, when you take your DMO product off, just check the areas of skin for yourself or your child and just be happy that they're not too deep a mark or there's no mark there at all. If you begin to see marks appearing at a later stage, perhaps 2, 3, 4 months of wear, this is likely to be because of growth. We cannot predict growth. Children will grow at their own rate. And as a parent, you can see this as their clothes begin to get a little small or the trousers begin to get a little higher from the ankle. With the DMO, you will find this in a number of ways. Perhaps it's a little bit harder to put on. You're feeling it a little tighter. Perhaps the marks are beginning to appear in certain areas that were not there before. And you may get marks across the top of the shoulder because as we grow in height, the suit will grow so far, but the likely places to get marking when you're growing out of a suit is at the shoulder and possibly at the groin area. So watch out for these potential growing marks. And best advice is to get in touch with the clinician who measured you, or get in touch with DMO, a clinician from our company, and we will give you advice. And the way to help make the DMO better fit again, maybe an alteration to add some material to the suit to give it extra growth and extra length of life. But if there are too many areas that need to be altered, then this would tell us that you need to remeasure for a new product.
Okay.
Now we've looked at the fitting for a child and particularly for a suit. It is the same for an adult. You need to go through the same checks of the arms, the leg, neckline of whatever DMO product that you have. And on an ongoing basis, check when you take off your DMO product and look for similar lines and marks that we talked about. But for an adult, it is unlikely that you will grow out of your DMO product. It is more likely that it will be wear and tear over a length of time, or you may find that it feels tighter or feels looser. And for the tightness and the looseness, it's likely to be an increase or decrease in weight rather than growing out of it. Again, we can do something about that. If you are still in touch with your clinician, then this is the first person to go back to and tell them that you think your DMO product is a little loose or a little tight, and it may be just in certain areas. You may have actually put on some muscle bulk, but it is good to have that checked. And if it is a little tight or a little loose, then your DMO product can be altered and the fit can be improved again. However, just as we talked about with the child, if there are too many areas that have changed in size, then this will likely mean that you will need to be measured for a new DMO product. Now, when we talk about wear and tear, this will happen over time. And how quickly wear and tear happens depends on how you look after your DMO product. Now, we give you all the information on how to wash your DMO product and how to put it on and take it off. Now, you can go onto our website and look at the videos showing you the best and correct way to put on your DMO product. And if you follow this, then your orthosis will last quite a long time. What is important also is the washing. Please be careful of the washing. We give lots of instructions on how to wash and also on things to avoid, like no tumble drying, no direct contact with the radiator, air dry. If our product is in contact with excessive heat, it will shrink. So please wash it and wear it the way we have advised, and you will find that your DMO product should last a long time. Now, there may be some areas of the product that will wear out before others do, particularly the glove and the sock. They are in areas of the body that will take a lot of wear and tear if we have improved your function along the way. All our other products are worn under the clothes, so they have a degree of protection from your clothes. But the glove and the sock may wear out quicker. And again, depending on where this is, we may be able to repair this for you. So please get in touch with your local clinician, or if you are not in touch with them anymore, please get in touch with us at DM Orthotics and we will advise you on what to do next. Thank you.